So hi, Marge.
Hi, how are you?
Very good. So I hope I can help you here today.
Well, I hope so too.
We always hope that. So tell me what's bothering you today. Where's the pain you're feeling today?
My pain is mostly in my lower back, the sacral area. I had back surgery in 2003.
Okay.
A ruptured disc in L4-5, between L4 and 5. And I also fell about 2 years ago off a quite steep curb.
Okay.
I landed on my right knee and kind of imbalanced my whole body.
Oh, so that's been a long-term effect from that
Yes.
fall. Well, good. I'm going to basically go through a series of Accutron Microlight techniques, and we're going to basically use process of elimination, find out which ones help you the most.
Will do.
Okay. So since the back is the main area, we'll start there. So what I'm going to do is go ahead and we're going to reset the device to go back to the factory settings. And just go to the basic circling the dragon setting. So what I'd like you to do is start out by just stand up, Marge, and just turn your back out this way. It's like that. And show me, just touch where the pain is, where the center of the pain area is. Right around that right sacroiliac joint area. Okay, what I like to do in my therapy is use what's called sequence therapy. And this is using a series of brief techniques, and after each one I test the patient to see how they're doing, to see which one has helped the most. And they kind of are cumulative. They build on each other's benefit, but certain ones will work better than others. So I'm starting with circling the dragon. Now for back pain, I pretty much rely on the purple color. Purple is specific for back pain, and Marge has some fairly significant back pain. So we're going to start with that. So I'm just going to put the two probes. This is more or less a circling the dragon technique. Just going right to the local area and doing a little bit of the dispersion. So there's the wiggling motion with the probes. Now a lot of times we may do this with the patient lying face down, but for the purpose of this demonstration it's easier to film this way. Plus some of the techniques actually are better standing up, the ones I'm going to do next. And really this Microlight does work in almost any position. So I'm just going really circling around the area of pain. Am I pressing too hard?
No.
Okay. I'd like to press in a little bit, but not. So now what movement would you be able to do to tell if the pain's better or worse? Is there a certain kind of bending or twisting? What usually brings it on?
Just standing.
Okay, so just tell me if you notice any perception of change in the pain with each. So let's say with that technique. Does it feel about the same or better, worse?
No, it does feel better. I felt energy moving down the leg.
You felt energy moving down the leg, okay.
But nothing upward, so
it's a
it
little.
does feel better.
So just to kind of use a construct, let's say that 10 was the amount of pain you had when you came in, 0 is total relief. So where would you say you are now in relation to where you came in for that first technique?
Maybe 5.
Okay, so 10 to a 5, that's like 50% decrease in pain. That's good, I'll take it.
That's good.
Okay, so now let's go to the next technique, because I want to basically see if I can get you down as close to a 0 as possible.
Okay.
That's my goal here.
Will do.
Yeah. So this technique is going to be using polarized probes to go from the painful area with a positive to negative on some distal acupuncture points down the leg. And again, just palpate. Tell me if there's anything really sensitive up here.
Yes. Right there.
Oh, right there. Well, let's see how about on the other side.
Okay. There.
Right there. Okay, so it's similar on both sides, a similar location. So we're still using purple light, so let's go to that point. Right about there. Oh,
Yes.
yeah, there it is, okay. Now the needle, the reading is already about 90% conductivity, connecting the lower back to this point. Okay, so I'm just going to go ahead and treat. Take some deep breaths. And of course it went up to 100 off the chart, so it's at maximum conductivity already that the meter can actually read. So I'm going to give you a nice generous 18 seconds here. One more press. Let's go back to the other side where you had a tender point on over here. Again, this is as above, right there. Oh yeah. These points get really tender in response to the back. This is one of the acupuncture effects we're dealing with here. One more time. Okay, now let's check again. Why don't you just stand and register whether it's the same, better, or worse than how you were before I did that technique.
It's sore, but I think it's from the treatment.
Yeah, I'm just touching it a lot.
But it feels much better than it. Up to a 7. Well, no, down, right?
Yeah. So maybe
3.
down to a 3? So like
Yes.
7 down, 7 to a
Right.
3. Okay. Well, good. So there's some progress.
Right.
And this treatment, one thing nice about microcurrent treatment is when it's done properly like this, you'll often get a better improvement later. There's actually a delay factor. So sometimes, let's say after 12 hours or 24 hours, you may even notice even better.
Oh, good.
I've had quite a few people with this specific treatment tell me that, where they had some benefit right away, but then the next day it was even better.
Oh, good.
So, yeah, we
I'm
like that.
looking forward
Yeah,
to
yeah.
it, yes.
I'm going to do another technique to help Marge right now, which is going to be to helping some of this upper back pain and neck pain that she's had. So the back is already, so far we have about a 70% improvement. It's going from 10 down to a 3. And I would expect there will be some more benefit as time goes by. But now let's work up here and go to the circling the dragon setting, which is now biphasic polarity with blue light on the probes. So I'm going to start up here at the occipital area. And we're just going to do 6 seconds at each level of the cervical vertebrae. Even though there's no pain here, this is going to help relieve the pain below the vertebrae because of the nature of the nervous system and the meridians that run through here. This area is very powerful for actually helping the whole body. And often around the area of the atlas and the axis can actually, that being blocked can actually cause issues almost anywhere in the body. Just how's that feeling in that area?
Good. I didn't think I had any pain in the neck, but I felt a few tender spots.
A few tender spots there, right. These are in acupuncture called the Huatou Jiaji points, and they're the nerve root points on either side of the spinal vertebrae. And they're very effective for neuropathies, local pain, releasing the muscle, the paraspinal muscles, and they even have effects on the internal organs. Another thing I'm going to do is just treat along this outer bladder meridian, just right inside the scapulas. This is also really useful pain in this area. Am I pressing too hard? Is it?
It's tender.
Okay, I'll just ease up. You're pretty sensitive, so I'll press a little more lightly. And over here on this side, inside the scapulas. Okay, so just shrug your shoulders a little bit, just see how that's doing.
Oh yeah, it's much looser, less aches.
So looser, less aches. Head moving pretty well.
Mm-hmm.